Okay, this training is entitled Initial Employee Training, and we're going to go over a packet called the New Hire Packet. So you should have this packet in front of you, which is a bunch of forms we're going to fill out and go over, and there's certain areas you need to sign. And so if you have the packet in front of you, we're going to cover these items in the same order as I read them. New Hire Training Checklist is the master checklist that's going to be completed once we complete everything. So you're going to have this kind of set to the side. And then, of course, the first item we're going to deal with is hepatitis B vaccination consent declination form. Then we're going to go over what's called Code of Safe Practices. Then we're going to get into the initial employee safety training document. Then we're going to go into employee safety suggestions and unsafe practice report. And then last but not least, we're going to cover what's the disciplinary procedure for employees of this facility. So if you're a brand new employee, then you're definitely watching the right video, or you may be an existing employee, but you just subscribe to our service, and that's why we're going to treat you as a brand new employee just the same, because all of these things have to be done whether you're an existing employee or just a brand new hire. So let's go ahead and open a packet to the first thing that you're going to see, which is your checklist. This is called the New Hire Checklist. Kind of put that aside, and we're going to keep going back to this checklist as we complete each section. Before you put it aside, however, I want you to look at item number 1. This means that you need to view bloodborne pathogen infection control videos. I believe there are 9 modules. They're about 10 to 15 minutes each. You're going to watch each video, take a quiz, and you have to pass with a 70% or better score. Otherwise, you get to retake the quiz again until you pass it. And once you pass all of those, then you're ready to come back to this New Hire Packet. So if you haven't done that, go ahead and pause the video right now and go ahead and start watching those videos and complete that whole section. And while you're there, you might as well watch the other training videos such as ATD or aerosol transmissible diseases exposure control and hazard communication videos, which you should watch, as well as the fire prevention and emergency response. These are all required by Cal OSHA, so you want to make sure you complete all of those before you come back to this checklist. Okay, now you're back. Now we're going to cover the second item, which is hepatitis B vaccination. So you should be looking at this form entitled HBV Vaccine Offer. And as you can see, this says that you've been informed of the symptoms and modes of transmission of bloodborne pathogens, including hepatitis B, which you have now because you've watched a video. And he says that I know about the facility's infection control system program and understand the procedure to follow if an exposure incident occurs. So all of these things have been covered now on the bloodborne pathogen video. You also state here that you understand that due to my occupational exposure to blood and other potentially infectious materials, I may be at risk of acquiring hepatitis B virus or HBV infection. I have been given the opportunity to be vaccinated with hepatitis B vaccine at no charge to me. Now, you have 2 areas that you need to look at. One is called hepatitis B vaccine consent, which says that you want to get the vaccine done or you want to be tested. You may be someone who've already been vaccinated a while back and you like to check your titers, which is the antibody level in your blood, to see if you may need a booster injection. Now, for either one of those, you would sign the top portion with your signature, date, and printing your name. If you don't want to do it, and you don't have to give a reason why you don't want to be vaccinated, you do not need to prove that you have been vaccinated or show any proof of that to decline the offer. It's simply up to you whether you want to decline the offer or not. Maybe you're not sure whether you should be vaccinated or not. That also would require you to decline the offer today, check with your physician, and then you can come back tomorrow or any other time in the future and change your mind and ask to be vaccinated again. But here's the one important thing. As soon as you consent to this offer, you have 30 days to get the first series of the vaccine started. If you wait longer than 30 days, then the employer is no longer obligated to pay for the vaccine. So you have to do this within the first 30 days after the date of this signature. So that's important. So once you complete this, the way I explained it to you, you can put it aside. The next thing is a required reading. This is called Code of Safe Practices. These are general safety procedures and policies that any office employee should observe. And as you can see, it goes over many, many different things, such as employees shall report all unsafe conditions and equipment to the supervisor or safety coordinator. Employees shall report immediately all accidents, injuries, and illnesses to the supervisor or safety coordinator. Means of egress, which means a way out of the building, shall be kept unblocked, well lighted, and unlocked during work hours. In the event of a fire, sound the alarm and evacuate. Upon hearing a fire alarm, stop work and proceed to the nearest clear exit, gather at the designated location. So these are required readings for you, and there's about, I believe, maybe 6 or 7 pages of safety policies that you need to read. If you come across something that you do not understand or a word that you may not know a meaning to, please don't hesitate to ask your supervisor to further explain what these policies mean and how they're implemented in the facility. So this is very, very important. Once you complete this, then you can go back to your checklist and check off item number 3, which is the Code of Safe Practices. So the next item is called Initial Employee Safety Training. As you pull out this form, you're going to see an area where you have to enter some information. So the name of your trainer is Julian Gadusi, that's me, and that's how I spell my name. So you can go ahead and write that there. The training subject is Initial Employee Training. For training materials used, you can write down safety manual, bloodborne pathogen videos, safety data sheets, and other forms. That's all you need to write there. Name of the employee would be your name. And if you are a licensed staff, you want to also enter your title, whether you're a dental staff or a medical staff. If you're licensed by the state, you want to also enter your title. Then date of hire or assignment needs to be there. Now, again, if you're an existing employee who's been there for a while, you also need to put your date of hire, original date of hire, whenever you were hired. And then again, you print your name where it says I and then the blank. You print your name there, and then you read the rest of it. Hereby certify that I have received training as described above in the following areas. And then you check all of these boxes if you have been trained in all of these areas. Basically, it says that you understand the potential occupational hazard in general in the work area and associated with your job assignment. Check that box if you understand that. Check the second box if you understand and have knowledge of laws and regulations for worker health and safety, such as Code of Safe Practices, which you just read, which indicates the safe work conditions, safe work practices, and personal protective equipment required for your work. Then the third one, it says you understand the hazards of any chemicals to which you may be exposed to, and that you have the right to information contained in material safety data sheets for those chemicals and how to look up and understand this information. This is all covered in the hazard communication video. That's why it's important for you to watch that video as well before you complete this form. And then the fourth item is you understand that you have the right to ask any questions or provide any information to the employer on safety, either directly or anonymously without any fear of reprisal. And we have a form for that we're going to cover in just a second. And certainly last is that you've read and understand the management's disciplinary procedure that will be used to enforce compliance with facility policies and Code of Safe Practices. And that's also a form which you're going to see in a minute. So you can wait on those 2 items, last items, until you see the form, or you can just simply check them now, and then you're going to definitely see them. But that's totally your choice. And then, of course, at the end, you're going to sign to the fact that you understand this training and agree to comply with the Code of Safe Practices for your work area, signature and date. And then you can put this aside. The next form is the same exact form in Spanish. If you are not well versed in English, you can certainly use that form. And then we come to the items that I just mentioned. One is called Employee Safety Suggestions and Unsafe Practice Report. And of course, the last one, which is the Sample Disciplinary Procedure for your facility. Now, your facility should already converted this to their own simply by entering their name and address there, and of course where it says ABC Medical Dental Facility, they need to enter their name there, and of course on the bottom signature the owner of the practice will have to have their name written there, and then you can choose the amount of days here. So this should already been done. The disciplinary procedure that you'll see will have your name of your practice on it. If it happens to be the sample version, please go back to your safety coordinator or the office manager and have them rewrite this and enter their name as the practice that is establishing this new policy called disciplinary procedure. Now let's go back to the employee safety suggestions and unsafe practice report. This is required by law to be given to every employee within the facility, and this is a way or a method of reporting any unsafe conditions or unsafe practices that you observe in the facility to your supervisor or safety coordinator. And this particular document can be turned in anonymously. So certainly the first part of it is pretty self-explanatory. You describe the unsafe condition or practice. Then you come up with the cause or other contributing factors that you think may have caused this. And of course, what your suggestions for improving this safety. And of course, has this matter ever been reported, yes or no, before to your supervisor? And the name of the employee is optional. You may have a department and certainly the date. Now, let me give you an example. Let's say you notice that a particular fixture in the bathroom is leaking. And so you write down the bathroom is leaking and water is leaking onto the floor. Cause is leaky plumbing or whatever that may be the cause. And then of course your suggestion is fix the plumbing issue, call a plumber. That's your suggestion. That's just that simple. So there's really not much that you have to do this. And then you can just slip this on the safety coordinator's desk or office manager's desk, and their responsibility is to address this immediately and try to get it fixed as soon as possible. Okay? So once you now you understand the safety suggestions and unsafe practice report, and you also have read and understand the disciplinary procedure within the facility, now you can complete the last two check boxes on your initial employee training document. Now, before you can sign the initial employee training document, you need to also go over certain things that are listed on the new hire training checklist. So go ahead and grab the checklist again and look at item number 4. Now, it says that you've completed the initial employee safety training document, and then you haven't completed until you review the location, proper use, and how to inspect the following safety items before the start of your employment. So the first item you need to check are your manuals. So you're going to go look at all your safety manual, your safety data sheet manual. It used to be called MSDS, now it's called safety data sheet or SDS manual. You need to look at your policies and procedures manual or anything else that they have for you to look at as far as written material. Then the next thing you need to look at is all the hazardous equipment. If you're a dental office, you would have a compressor to look at. Or a sterilizers you might have, whether medical or dental, both could have sterilizers. These are autoclaves that sterilize equipment. If you have x-ray equipment, you need to look at those. If you have MRI, CT scans, whatever equipment that could pose a hazard, you need to be looking at that. The next thing you need to look at is all of the employment posters. These are labor posters, NFPA posters, caution radiation, pregnancy precautions, and any other postings that the office has posted for you on your wall. Usually you'll find these in the lunchroom or the break room within the facility. The next thing you need to look at is all the safety equipment that are available for you in the facility, such as the medical emergency kit. And one of the things you need to look at when you open the medical emergency kit is make sure that it has the minimum number of meds in there, which are listed as epinephrine injectable, Benadryl injectable, nitroglycerin, albuterol inhaler or equivalent, and glucose. There are 5 minimum items. That's for any facility. But if you do any type of general anesthesia, IV sedation, or conscious sedation, you also have to have a crash cart. And sometimes you have anesthesiologists bring their own crash cart into the facility, so then you don't need to worry about all of these additional meds you have to have in a crash cart. But if you do your own general anesthesia or IV sedation or conscious sedation, you have to have a more complete emergency kit with an AED and a few other things. Then the second item you look at is your AED. If you have an automatic external defibrillator, and it's you must have one because you do general anesthesia and those items that I mentioned, then you need to check that. Then of course, you also, all of you have to have an emergency oxygen supply. So your facility has to have a designated portable emergency oxygen supply that is not being used for treatment And you need to know where that is and locate that. Go look at it, go touch it, and make sure that you know where it's at. Close to that oxygen tank, you also should see an ambu bag. An ambu bag is used for resuscitation, and you see pediatric patients and adult patients, you have to have both size masks with the ambu bag. You also have to have a pretty good first aid kit. Again, when we check these on a monthly basis, we're checking for items missing or any expired meds left in the kit. And of course, the other items that you look at are fluid spill kits. This is bodily fluid spill kit, which is used for any patient regurgitation or any blood spills. These are bodily fluids, and you need to have a spill kit to do that. If you still use, for example, X-ray solutions like Fixer Developer, or use any type of formaldehyde product or glutaraldehyde product, you also have to have a chemical spill kit, and your facility has to have already obtained that. If they don't know where to get one or don't have one, please let them know that they can contact us, and we can certainly point in the right direction. But not every facility has to have a chemical spill kit. It's only for hazardous material. Then you need to locate your eye wash station and learn how to turn it on. And you also remember that as a maintenance, what we do is we flush the eye wash station for 3 to 5 minutes once a month. And these monthly safety inspections must happen by different employees each month. So if you have, let's say, 5 employees, every 5 months, it'll be your turn again. So each employee will take turns each and every month, where every month a different employee is doing the monthly inspection. And there's a checklist, there's another monthly inspection checklist in your records manual that your safety coordinator should be familiar with, and make sure that is being implemented and that you get into the rotation as a new employee. And certainly you're going to be looking at your fire extinguishers. Again, what we look for in the fire extinguishers, we check for the seal to be intact. The seal is a plastic seal around the pin, so if someone pulled the pin, they would have to break that seal. If you see that seal broken, that fire extinguisher is no good. You need to immediately get a fire extinguisher service to come and reseal that unit. They check the pressure, they check the content, and then they reseal it for you and retag it for you. So that's something that you need to know. And there might be other items of safety within your facility, such as maybe an earthquake preparedness kit. Maybe you'll have some additional things that the facility decided to include in your safety equipment. Whatever it is, you need to know where they are, and you need to also know how to check them each month. Now, the next item is other important items such as electrical breaker panel. You need to know where the breaker panels are in your facility. In case of an emergency, electrical emergency, you need to know how to go and shut them off. You also need to know where the emergency water shutoff valve is within your facility, and make sure that you know how to turn the water off in case you have a leak or some kind of a pipe bursting in your facility and your facility is being flooded. You also need to know where the fire or smoke alarms may be, so that you know where they are and that you can check them and make sure that they're in good working condition. And last but not least, you need to know where the emergency meeting location is, where you need to meet in case of an emergency evacuation. That means when you evacuate for an emergency, whether it's fire, earthquake, or whatever, you cannot just go and get in your car and go home, obviously. So you need to know where the location is, where all the staff are supposed to meet, ask a few questions, make sure everyone's okay. At the same time, make sure everybody made it out of the building. So the last item here that needs to be checked under number 4A is hazardous waste related items such as sharps containers. You need to know where all the sharps containers are. You need to make sure that there's a sharps container wherever there are any injections or any procedures being done involving sharps, and the sharps container has to be in the room. You're not allowed to carry any contaminated disposable sharps from room to room. The next item are biohazard containers, what we call red bags, and these are basically containers that are in clinical areas that are lined with a red bag which has a biohazard symbol on it. And also it is required for it to have 5 biohazard stickers or labels on it, which would be on all 4 sides of the container and 1 on the lid. Make sure those biohazard labels are on there, locate them and look at them and check and inspect them like that. Also, you need to have a pharmaceutical waste container for any expired meds or half-used meds to be disposed of. You do not want to put pharmaceutical waste into a sharps container. Certainly, if you are a dental facility, then you need to have your amalgam waste container where all the amalgam type of waste goes in there, such as any extracted teeth with amalgam filling, any chairside traps that might have amalgam in it, as well as your vacuum traps. If you use amalgam as a filling material as a dentist, then you'll have amalgam scraps. You also will also have to put the empty capsules of the amalgam that came in, also all goes into the amalgam container. And obviously, if you're a medical facility, you don't have to deal with amalgam at all. And also, you need to locate your personal protective equipment that have been provided to you by your employer. Make sure they're the right size and they're the right kind for your body type. In other words, you need to know what size gloves you're supposed to be wearing and make sure they have that available. So what size mask, what size eyewear protection, and of course gowns whenever you do any type of procedures requiring that. Now also, you want to make sure that you're wearing proper shoes. If you're a clinical staff, you cannot be wearing any type of shoes that has a porous surface, okay? In case you drop a sharp instrument, it cannot penetrate your shoe and stab you in your toes. So you want to make sure that you're wearing something with a solid material such as leather or whatever other type of leather material where it's impenetrable if you drop a sharp instrument, or if you obviously spill any chemicals that could seep right into your shoes. And so that's all that. And of course, item B under 4 is that you have reviewed the employee safety suggestions and unsafe practice reports. You can check that box because we just reviewed it just a few minutes ago. And then the last but not least is the disciplinary procedure that we just went over with you, and you can check that box as well. Once you complete this checklist, you need to sign it, put your title there if you're a licensed staff, and certainly the date. And then you turn all of this in, including all the other forms we went over, to your safety coordinator for a completed training session. Now, hope this wasn't too hard for you. And again, if you have any questions, please feel free to call us. Our phone number is on the screen. You can contact us individually, or you can ask your safety coordinator to contact us for any questions or concerns. Again, thank you. This concludes our initial employee training. Welcome aboard.